Today's topic is randomized control trials, that is RCT. The basic steps involved in RCT include drawing up of a protocol, selecting reference and environmental population, randomization, manipulation or intervention, follow-up and assessment of the outcome. First, selecting of the suitable population, that is reference population, then selecting of experimental population, then making necessary exclusions, that is not eligible, and those who do not wish to give consent. Next, randomization, experimental groups and control groups, then manipulation and follow up, and the final step is assessment. First one, drawing up of a protocol. We should specify the aims and objectives of the studies and should be strictly adherent throughout the studies. Its main aim is to prevent bias and reduces the sources of the error. It includes the questions to be asked for both the reference and the experimental population, criteria for selection of control and study groups, what is the size of the population, and standardization of work procedure, responsibilities of the parties involved, and evaluation of the outcome of the study. Next step is selecting references and experimental population. Reference population, it can be as broad as mankind or geographically limited or limited to age, sex or occupation. It comprises population of the whole cities or school children or obstetric population. Experimental population or study population. Study population is mainly derived from the reference population. It is the actual population that participates in experimental studies, and it should have same characteristics with the reference population. If the study population differs from the general population, it may not be possible to generalize the findings in the studies. So the participant must fulfill the three criteria. It should include, they must give the informed consent about the procedure, purpose and possible dangers of the trials, and they should be the representative of the population, and they should be qualified or eligible for the trial. Next, randomization. It is the statistical procedure by which participants are allocated into groups. It is an attempt to eliminate bias or allow for the comparability. It is the heart of the clinical trials. It ensures that the investigator has no control over allocation of the participants into either study or control groups, thus eliminating the selection bias. Every individual gets an equal chances of being allocated into either groups. It is done only after the participants have entered the study, that is, only after having qualified for the trial and given his consent. Next, manipulation. It creates an independent variable whose effects is determined by measuring the final outcome. And follow up, this implies examination of the experimental and control groups at different time with equal intensity under same circumstances at same time till the final assessment. Follow-up may be short or may require many years depending upon the study taken. Assessment, positive results and negative results. Positive results, they reduce the incidence, reduce severity of diseases and reduce cost to the health services. Coming to the negative, severity and frequency, side effects, complications including death. Techniques that are available for the analysis of the data as they are collected, but it is more useful to analyze the results at the end of the trials. Coming to the biases, subjective bias, observer bias and evaluation biases. To reduce the biases, blinding is adopted. Single blind participant is not aware whether he belongs to study or control groups. Double blind, both doctor and participants are not aware of group allocation and treatment received. This is the most common type which is used. Coming to the triple blind, both participant, doctor and investigators are not aware. This is the ideal type.